The major disadvantage of cord blood, when you compare it to marrow or peripheral blood, is that it's a small collection compared to the marrow or blood, and there's a very limited number of cells, stem cells, immune cells. And so when you give a patient a preparative chemotherapy or chemotherapy plus radiation, and you infuse the stem cells, that time from the day that you give them their transplant until the time they recover is a high-risk time in terms of they don't have white cells to fight infection, they don't have platelets to keep them from bleeding. The beauty of the strategy that we've employed with ex vivo expansion is that we grow those cells up on a stromal-based nurturing environment, and we get many more cells that are rapid engrafters. And so when we infuse the expanded cord blood, we shorten the time to neutrophil and platelet recovery significantly, from over a month to 15 days for the neutrophils, and the platelets from several months down to 40 days. And so we think the safety of the patient is going to be protected. The stroma are the supportive network of the marrow. So in the bone marrow, you have the hematopoietic elements, the white cells, the platelets, the red cells to carry oxygen, and they live in an environment in the bone, and what's generated by fibrous stromal cells as a milieu of the marrow, which allows cells to grow and be nurtured and expand on their own when you're in the bone marrow.
So the process is we establish the mesenchymal stem cells in culture flasks, and so they provide an environment where we can put the cord blood cells on top of the mesenchymal stem cells. And this really recapitulates what happens in our bone marrow, where you've got the microenvironment, which is the mesenchymal stem cells, and they provide the optimal environment for the cord blood stem cells to proliferate and differentiate. And so we also supplement growth factors to the media that the cells are grown in, and this drives them into the direction of differentiation that we think is optimal for the patient treatment.
With our current study, we were able to expand the total nucleated cells, this total cell dose, about 14-fold, and the CD34 cell dose, which is the engrafting cell, by about 40-fold on average.